Hi, and welcome viewers of Nursing Academy 101. In this video, we'll talk about Nursing Pediatric Multiple Choice Questions and Answers, Part 3. But before we start, please don't forget to subscribe, like, and share the channel to encourage us to continue and provide you with all new. Question number 1. The nurse is caring for a 1-year-old diagnosed with acute renal failure. Edema is noted throughout the child's body, and the liver is enlarged. The child's urine output is less than 0.5 milliliter per kilogram per hour, and vital signs are as follows: heart rate 146, blood pressure 176/92, and respiratory rate 42. The child is noted to have nasal flaring and retractions with inspiration. The lung sounds are coarse through. Despite receiving oral K-oxalate, the child's serum potassium continues to rise. Which treatment will provide the most benefit to the child? A. Additional rectal K-oxalate. B. Intravenous furosemide. C. Endotracheal intubation and ventilatory assistance. D. Placement of a Tinkoff catheter for peritoneal dialysis. The answer is D. Placement of a Tinkoff catheter for peritoneal dialysis. Question number 2. The parent of a child diagnosed with acute renal failure asked the nurse why peritoneal dialysis was selected instead of hemodialysis. Which is the nurse's best response? A. Hemodialysis is not used in the pediatric population. B. Peritoneal dialysis has no complications, so it's a treatment used without hesitation. C. Peritoneal dialysis removes fluid at a slower rate than hemodialysis, so many complications are avoided. D. Peritoneal dialysis is much more efficient than hemodialysis. The answer is C. Peritoneal dialysis removes fluid at a slower rate than hemodialysis, so many complications are avoided. Question number 3. A child receiving peritoneal dialysis hasn't been having adequate volume in the return. The child is currently edematous and hypertensive. Which would the nurse anticipate the physician to do? A. Increase the glucose concentration of the dialysis. B. Decrease the glucose concentration of the dialysate. C. Administer antihypertensives and diuretics but not change the dialysate concentration. D. Decrease the dwell time of the dialysate. The answer is A. Increase the glucose concentration of the dialysate. Question number 4. During hemodialysis, the nurse notes that a 10-year-old becomes confused and restless. The child complains of a headache and nausea and has generalized muscle twitching. This can be prevented by which of the following? A. Slowing the rate of solute removal during dialysis. B. Ensuring the patient is warm during dialysis. C. Administering antibiotics before dialysis. D. Obtaining an accurate weight the night before dialysis. The answer is A. Slowing the rate of solute removal during dialysis. Question number 5. 1 week after kidney transplant, a child complains about abdominal pain, and the parents note that the child has been very irritable. The nurse notes a 10% weight gain as well as elevated BUN and creatinine levels. Which of the following medications would the child most likely be taking? A. Codeine tablets. B. Furosemide. C. Miralax powder. D. Corticosteroids. The answer is D. Corticosteroids. Question number 6. The nurse is caring for a 1-month-old term infant who experienced an anoxic episode at birth. The healthcare team suspects that the infant is developing necrotizing enterocolitis neck. Which would the nurse expect to be included in the plan of care? A. Immediately remove the feeding nasogastric tube from the infant. B. Obtain vital signs every 4 hours. C. Prepare to administer antibiotics intravenously. D. Change feeding to half strength, administer slowly via a feeding pump. The answer is C. Prepare to administer antibiotics intravenously. Question number 7. Which manifestation suggests that an infant is developing necrotizing enterocolitis neck? A. Absorption of bolus orogastric feedings at a faster rate than previous feedings. B. Bloody diarrhea. C. Increased bowel sounds. D. Appears hungry right before a scheduled feeding. The answer is B. Bloody diarrhea. Question number 8. More education about necrotizing enterocolitis neck is needed in a nursing in-service when one of the participants states: A. Encouraging the mother to pump her milk for the feedings help prevent neck. B. Some sources state that the occurrence of neck has increased because so many preterm infants are surviving. C. When signs of sepsis appear, the infant will likely deteriorate quickly. D. Neck occurs only in preemies and low birth weight infants. The answer is D. Neck occurs only in preemies and low birth weight infants. Question number 9. The nurse is caring for an infant who has been diagnosed with short bowel syndrome (SBS). The parent asks how the disease will affect the child. Select the nurse's best response. A. Because your child has a shorter intestine than most, your child will likely experience constipation and will need to be placed on a bowel regimen. B. Because your child has a shorter intestine than most, he will not be able to absorb all the nutrients and vitamins in food and will need to get nutrients in other ways. C. Unfortunately, most children with this diagnosis do not do very well. D. The prognosis and course of the disease have changed because hyperelimination is available. The answer is B. Because your child has a shorter intestine than most, he will not be able to absorb all the nutrients and vitamins in food and will need to get nutrients in other ways. Question number 10. The nurse is caring for a 3-month-old infant who has short bowel syndrome (SBS) and has been receiving total parenteral nutrition (TPN). The parents ask if their child will ever be able to eat. Select the nurse's best response. A. Children with SBS are never able to eat and must receive all of their nutrients in intravenous form. B. You will have to start feeding your child because children cannot be on TPN longer than 6 months. C. You will start feeding your child soon so that the bowel continues to receive stimulation. D. Your child will start receiving tube feeding soon, but will never be able to eat by mouth. The best answer is C. Will start feeding your child soon so that the bowel continues to receiving stimulation. Question number 11. Spina bifida involved the failure of the neural tube to develop or close during embryonic development, causing defects in the spinal cord and in the bones of the spine. Nursing care planning goals for clients with spina bifida include prevent infection, maintain skin integrity, prevent trauma related to disuse, increase family coping skills, education about the conditions and support. An infant is born with a sac protruding through the spine, containing cerebral fluid (CSF), a portion of the meninges and nerve roots. This condition is referred to as A. Meningocephaly, B. Myelomeningocele, C. Spina bifida occulta, D. Anencephaly. The answer is B. Myelomeningocele. Question number 12. The nurse is caring for an infant with a myelomeningocele. The parent asks the nurse why the nurse keeps measuring the baby's head circumference. Select the nurse's best response. A. Baby's head are measured to ensure growth is on track. B. Babies with a myelomeningocele are at risk for hydrocephalus, which shows up as an increase in head size. C. Because your baby has an opening on the spinal cord, your infant is at risk for meningitis, which can show us as increase in head size. D. Many infants with myelomeningocele have microcephaly, which can show up as a decrease in head size. The answer is B. Babies with a myelomeningocele are at risk for hydrocephalus, which shows up as an increase in head size. Question number 13. A parent of a newborn diagnosed with myelomeningocele asks what is a common long-term complication. The nurse's best response is A. Learning disabilities, B. Urinary tract infections, C. Hydrocephalus, D. Decubitus ulcers and skin breakdown. The answer is B. Urinary tract infections. Question number 14. Which is included in the plan of care for a newborn who has a myelomeningocele? A. Place the child in the prone position with a sterile dry dressing over the defect. Slowly begin oral gastric feeding to prevent the developing of necrotizing enterocolitis. B. Place the child in the prone position with a sterile dry dressing over the defect. Begin intravenous fluids to prevent dehydration. C. Place the child in the prone position with a sterile moist dressing over the defect. Slowly begin oral gastric feeds to prevent the development of necrotizing enterocolitis. D. Place the child in the prone position with a sterile moist dressing over the defect. Begin intravenous fluids to prevent dehydration. The answer is D. Place the child in the prone position with a sterile moist dressing over the defect. Begin intravenous fluids to prevent dehydration. Question number 15. Which does the nurse include in a child with myelomeningocele post-operative plan of care following ligament release? A. Encourage the child to resume a regular diet, beginning slowly with bland foods that are easily digested, such as banana. B. Encourage the child to blow balloons to increase deep breathing and avoid postoperative pneumonia. C. Assist the child to change positions to avoid skin breakdown. D. Provide education on dietary requirements to prevent obesity and skin breakdown. The answer is C. Assist the child to change positions to avoid skin breakdown. Question number 16. A newborn with a repaired myelomeningocele is assessed for hydrocephalus. Which would the nurse expect in an infant with hydrocephalus? A. Low-pitched cry and depressed fontanelle. B. Low-pitched cry and bulging fontanelle. C. Bulging fontanelle and downwardly rotated eyes. D. Depressed fontanelle and upwardly rotated eyes. The answer is C. Bulging fontanelle and downwardly rotated eyes. Question number 17. 14-year-old Casey is admitted to the emergency department with a fractured wrist. You assist with a fiberglass cast application to her wrist done by the physician assistant. Casey will be able to be discharged. We want to make both Casey and her parents aware of the importance of neurovascular assessment. We would like the parents to be aware of abnormal findings related to the casted extremity. Which of the following findings should be reported to the primary care provider immediately? A. An increase in pain out of proportion to the injury and diminished pulses. B. Itchiness under the cast. C. Rapid capillary filling of the nail beds. D. Irritation around the cast edge. The answer is A. An increase in pain out of proportion to the injury and diminished pulses. Question number 18. When teaching Casey home management of her cast, you should include which of the following instructions? A. Clean the cast daily with warm soapy water and a soft brush. B. Gently knock on the cast at the injury site to assess for pain. C. Use a tongue depressor to scratch under the cast. D. Notify the physician if she feels any hot spots under the cast. The answer is D. Notify the physician if she feels any hot spots under the cast. Question number 19. Which of the following nursing diagnoses would not be appropriate for the infant who has been casted for a clubfoot deformity? A. Mobility, physically impaired related to restricted movement secondary to casted legs. B. Skin integrity, risk for impairment due to pressure points or rough edges from the leg glass. C. Parenting, risk for alteration in parenting related to the birth of a child with a structural defect. D. Pain, acute pain related to casting of both lower extremities. The answer is D. Pain, acute pain related to casting of both lower extremities. Question number 20. In addition to the positive Ortolani and Barlow signs, congenital hip dislocation in the infant may be recognized during physical assessment as A. Shortening of the limbs on the unaffected side. B. Limited adduction of the affected hip. C. Restricted abduction of the affected hip. D. Equalized skin folds of the thigh on abduction of the hips. The answer is C. Restricted abductions of the affected hip.